As you know, this is an evolving and complex situation.
The Chinese city of Wuhan.
The contagious coronavirus.
The virus showing up across
The
China.
number of confirmed cases keeps
the
growing.
city of 11 million
says
people.
the infected passenger passed through busy SeaTac airport in Seattle.
In South Korea, another hotspot.
Northern Italy, we've
We
seen
should be doing things that separate us as best as possible.
With a quarter of Italy's population in quarantine.
to try to stop the spread of this virus.
Hospitals are already becoming overwhelmed.
Mysterious virus now spreading across the globe.
This is not business as usual.
Economic and social life is grinding to a halt.
Hi, so I just finished working my 12, which was really 13-hour shift. I had no lunch break. I did not have any time to eat. I'm thirsty, I'm tired. This coronavirus has been something that nobody really expected. In the beginning, people thought of it lightly, thought it was just like the flu, when in reality, this is much worse. It can't even relate. I have seen so far people coming into the ED, complaining of cough, fever. Sometimes they are sent home because they're stable enough to just isolate themselves. But within 4 days, they come in with bilateral lung pneumonia, getting intubated. Tonight, I had 6 patients. Their oxygen levels was decreasing. It was back and forth, running from one patient to the other, making sure, that they don't die. It was a lot. I've never seen anything like this in my life. I had this one man that was completely fine at home with his family, had cough, fever for 4 days, came in and got intubated right away. His oxygen level was in the 70s, even being intubated. It was a lot to handle. Families can't come inside. They don't know what's going on. What do you tell them? What do you tell them when they come in alive, maybe not well, they're in respiratory distress, but they can change from being okay to not being okay very fast. We have to be on our toes at all times, because if you leave a patient for too long thinking they're fine, you go back and they're dead. My biggest fear is having a patient that came in alive and looking well ultimately die on me. We do our best. We really do.
Good morning, everyone. I am on my way home from work. It is almost 8 a.m.
I'm mentally exhausted. I'm physically tired.
We're dealing with, so much, and I feel like forgetting a little bit to take care of ourselves.
I'm asthmatic. I am so scared. But, when I get put there, I'm in the zone.
And then you have your own fears. Like, I don't want to get my family sick. I don't want to do that. And then you feel guilty about thinking like that.
It's one thing when you worry about catching this thing, but when you're working so close with these patients who are infected, is you always have that question in the back of your mind, do you have it?
The limited resources within the hospital aren't just ventilators and masks. We are limited resources as well, healthcare professionals. And at some point, some of us are going to get sick, and that's going to put more work on other nurses.
I am really feeling for my fellow coworkers over in New York who are struggling, and I hope they're going to be okay. All right, good night.
Hi everyone, it is March 27th today. It's 8:30 a.m. I just got home from a 13, 14-hour shift. So I had 4 patients. All of them were COVID-19 positive. We've rapidly become the epicenter of COVID-19. My whole unit is basically becoming a COVID med-surg unit. We've had coworkers already test positive. So I kind of have come to terms with the idea that I could very well catch coronavirus. So that's a reality for me that I've come to terms with. So yeah, I'm gonna go sleep. That was the first night of 3, so I'll be back tonight. Yeah. So before I actually go in my apartment, I take off my shoes. I will basically take my clothes off right as soon as I get in the door, put them in a trash bag where they will stay at the front door until I wash them after this row of shifts. And then I'll go get in the shower right away and basically burn my skin off. So that's how we do it.
Hey, so last night was my first shift back after having 2 nights off. I feel like lately I've been having a little bit more of a difficult time with coping. My frustrations have definitely been coming out more. I've been a little bit more hostile towards people, and really everybody is just there to try to help me and listen to me, and I know that, but it's been eating at me a little bit more so than it was maybe a week or 2 ago. I think it's just hard that there really is not an end in sight, and although the news says that the curve is flattening, and you know, of course it's true that hospital admissions are down, it just still feels like such a whirlwind when you're in it, and it's totally chaotic, and it's just difficult when you see, you know, some positive things on the news and then you go to work and it's still, you know, a lot of the bad. But we're doing everything we can, you know, just to be the best nurses that we can be right now, and I'm just so proud of everybody, and sometimes it's just harder than others.
There's just some nights that test all of your human energy, strength, and you just watch the clock until 7 a.m. and you just keep doing stuff until 7 a.m. There's no stopping. And patients' conditions change, and you have to adapt, and you have to prioritize what's most important, and it's so difficult. And along with dealing with medical conditions, it just feels like the whole world falls on you sometimes. Like everything is your job, and you are the person that's managing their direct care. And you know, there are times where you make mistakes and you just can't be in all different places at once, and it is so hard when you get patients that are rude to you or that ask you why you're so busy or why you're not spending enough time with them, and it's so difficult. And I'm just so over COVID, and I think we all are, and it's getting to be so much. So I'm back tonight. I'm gonna get some rest and eat and hope for a better shift tonight.
So, right now I do have my goggles on and my respirator. Then when I enter a COVID room, I have a face shield on. So as you can see, this is the gear I wear.
So, this is how we have to work for 12 hours now.
I don't know if you can even hear me, but imagine trying to talk to a patient through this gear 12 hours a day, and family members on the phone when they call, or doctors for that matter.
Here we go, 12 hours. Let's see what it's like.
As you can see, I have officially ended my 12-hour shift. I'm off for the next 2 days. I have worked about 6 or 7 days in a row. I don't remember, I kind of lose track. But as you could tell, my face from my PPE and my mask, definitely hurts, definitely sore. Definitely going to enjoy not being cooped up in my PPE over the weekend. But hey, this is the life of the frontliner, and if I have some battle scars or wounds or red marks on my face to show my fight in this war, then it's all worth it. Stay safe, people. Stay home. Let us do our job, and in the end, we will all win this battle together. And with it was a card that says, "You are amazing." And it says, "Nurse Misty, you will always be in our hearts for how you were so willing to go above and beyond in our care of our mother. Thanks for being her family when we were unable to be there. We pray that God will bless you richly for the love and care you give your patients. Sincerely, thank you is not enough." It's hard. It's hard to be the only person here for these people when they don't have family.
Just got done with my shift. I work night shift, 7 p to 7 a. It's just so stressful emotionally and physically to see people deteriorating or not following social recommendations, and it's very frustrating as a provider when your therapies aren't working. Like, usually they work on some level, and it's just they don't work, and it's very professionally frustrating when they don't work. Like, the families are looking to you, like, what's going on? I don't really have definitive answers. It's just stressful. And then you come home and I just feel really dirty. Like, I don't want my son touching me until I clean up. And even then, it's like, well, don't kiss me. Even my husband, it's just like, I don't want to get you sick. I'm 38, going on 39 weeks pregnant. So, might be a little emotional in general, but this definitely isn't helping that. So I feel like I'm kind of alone, even though I'm not. My family's really supportive. It's just when these families break down, they lean on you and you just absorb all this, their stress, their anxiety. You hope that you take that. You probably don't take all of it, but you take enough to where it kind of weighs on you. So that is the current state of things. Sun's coming up. I know my son's probably up. I've looked at our camera. He's probably up running around, and you want to go in smiling, but sometimes it's fake. How was your shift? Great, I guess. I don't really want to go into details. I don't think I even talked for like the first hour I'm home. I'm just processing things from work. It's a lot. It's 7:56. I'm gonna fix my face and walk up and see my family now.
Well, it's been another crazy day. Usually here at the hospital, my wife and I take a little time out and eat lunch together, but we weren't able to today because she was caught up in the cold with a patient that possibly has the COVID-19. I just learned the other day, talking to a friend of mine, we worked at the county sheriff's department in Cuyahoga years ago, that one of our friends had passed away from the virus. So it's definitely affecting a lot of people. And you really don't know how you're gonna react until it's like close to home, We just keep our heads up, put our faith in God, and keep on going. All right.
At some point, some of us are going to get sick, and that's going to put more work on other nurses. And We have to just realize that this COVID crisis is a marathon, not a sprint. The saddest part about working on the COVID unit thus far has to be watching people be alone. It just stinks that there's no visitor policy for obvious reasons, and those people have no one. And we had a case where they came in after being on a cruise ship from a different country, and luckily one of the nurses found their family on Facebook and was able to kind of like reunite them via conference call. And of course, like, everyone cried, and I think those are like the touching moments at this time, because patients are alone and they're dying alone, and that's just the sad truth of it all. So I'm about to go sleep and hopefully get some rest and start again tomorrow.
Hey, it's Luis checking in again. I am completely exhausted, so I'm here as a traveler in Northern California. I came here to help out since it was one of the hotspots for COVID. People are extremely nice here and really accommodating. I happened to go to a restaurant here and they refused to let me pay. That was amazing. Like, just seeing people really care and support us going through this was very special. It definitely made me feel like I have to pay it back, and I will. As far as the COVID status up here, this is kind of one of the highest impacted areas in California, but it's still manageable. And I'm happy that just maybe we beat the curve, and all this work that everybody's doing here, the quarantine, not being around everybody else, hopefully it's paying off. It's quite early to say if it is or isn't, but as of now, it's manageable, and I'm happy for that. I'm happy for California so far.
It's just kind of like a slap in the face to everything that, we've done. And then when you hear that people say that it's a hoax, it's devastating, because you've been with families that have lost their loved ones' lives.
Yeah, I would check my feed and it would be all this isn't real, this is the government, or it's the hospitals trying to make money.
I actually was out the other day, and this older gentleman standing in front of me, and he's kind of annoyed, waiting in line, in social distancing line with the mask on.
There's not a way to force someone to believe something.
He's kind of ranting to me, like, kind of alluding to, like, the virus is not real.
I'm seeing the worst of the worst, and you're telling me this is all fake.
It's hard to tell someone who's literally going to work and doing it that their experience isn't real.
Like, I wish I could just show you these people who are dying alone,
The whole time I'm thinking, like, here's this geriatric guy
probably the highest risk for COVID who doesn't believe in it.
I deal with it every day. It's an emotional toll that is taken. I cry in the car sometimes. Like, I'm dealing with this and you're telling me this is all fake.
And I'm just like shocked.
I don't even know how to even start the conversation without screaming.
We have debates that go on here between coworkers who wear masks, don't wear masks outside of work.
It's trial by fire, unfortunately. And I think that's kind of the lesson that we're learning.
There's just so much going on all at once. And I think it's like heavy on everyone. And then you have people who are working in the hospital and people who are literally out there defying everything you're doing.
So I will say, and he can vouch for me, when all this came out, I was one of the ones that said, this ain't no worse than the flu. It's just a virus. It's going to run its course. Well, I ate my words tremendously. It's definitely not like the flu. It's definitely scarier than the flu.
A lot of the cases that are testing positive right now, at least in San Diego County, are not people who require hospitalization, but that doesn't mean that those positive cases won't come across people who will.
It is true that they could spread that to someone else, and it does leave lasting effects on your lungs that now we know. People that have had coronavirus, their ability to get back to their previous quality of life has been changed because they could have long-lasting lung inflammation and damage that doesn't allow you to exercise and move in the same way that you did before.
And so we just got to hunker down. We have to be unified in thought that I'm going to protect the next human being, And how do you do that? Wash your hands, wear a mask.
I wish people the best. If you don't want to wear a mask, hopefully you don't see me soon. It's kind of what I chalk it up to. I hope I don't see you, because if you see me, things did not go the way that you planned them to go.